let's talk about strokes because that is what I am currently studying for. So there are a few different types of strokes, but all of them are classified by a disruption of blood flow to the central nervous system, namely the brain, which is the most common, as well as the spinal cord, which is much less common. The disruption of blood flow causes a lack of oxygen to the brain, which leads to hypoxia, which literally means lack of oxygen, and eventually cell death. Now, the lack of oxygen and the cell death causes irreversible brain tissue damage. There's usually a central core, which is kind of the main area of the stroke, which is unfortunately irreversibly damaged in the event of a stroke. However, it is also surrounded by what is called a penumbra, which is an area surrounding the core that is damaged but repairable tissue if the stroke is caught in time. Now, there are a few main warning signs to look for. The commonly known ones are loss of sensation and control of the facial muscles on one side, as well as usually the loss of control in one arm. However, there are other things. There's an acronym to remember that, saying be fast, which is kind of the takeaway message of strokes in general. So be fast stands for balance, eye, face, arm, speech, and time. Basically, they are signs of what to look for: lack of control in eye and facial movement, lack of sensation and movement in muscles, loss of balance, and difficulty speaking, as well as time. Just kind of remember, you need to be really fucking fast to avoid the most brain damage as possible, because the longer it takes to treat, the more irreversible brain damage can occur. Now, in pretty much every case of stroke, the individual that is affected is left with permanent damage and disability, which is very bad. It is the second leading cause of death and one of the highest leading causes of disability worldwide. And unlike some other diseases, it is equally prevalent in males and females, which is not common in a couple other cases. Now, the severity and symptoms of the stroke vary depending on the location of the vascular disruption. You will have different symptoms depending on where within the system that the stroke occurs. And there is also a course that I did take for extra credit in my clinical neuroscience class that is for assessing stroke severity. You use a bunch of different things to evaluate sensation and responsiveness, and all that is very interesting. And there are a few different risk factors that can increase your chances of getting stroke, namely hypertension, also known as high blood pressure. If you have chronic high blood pressure, you are at more of a risk of stroke, as well as things like genetics. Usually if a direct family member has had strokes before, you as related to them do have a higher risk of stroke, as well as diet and lifestyle and exercise, and all of that do play a role in the risk of stroke. Now, like I said, if treated in time, the long-term effects can be minimal. However, unfortunately, most people do have lasting disability from stroke. So if you think you might be at risk of stroke due to lifestyle or family or anything, maybe just keep an eye out and educate people around you of the warning signs, or if you know somebody that may be at higher risk of stroke, also educate yourself about the warning signs, because again, time is very, very important to avoid as much damage as possible.